Hello everyone. Today we are here to study the chapter of civics, that is role of government in health. In this chapter we are going to study about what is the responsibility of the government to provide proper health services to the people of the country. First of all, what is health? According to WHO, that is World Health Organization, health is a state of complete physical, mental, and social well being, and it's not merely the absence of disease or infirmity. One should be fit in all the sense. First of all, we are going to study about the positive aspects of the healthcare services in India. India has the largest number of medical colleges in the world. Secondly, our country produces largest number of specialists. Next, India has the large number of medical tourists. That means the people are coming to India to get the treatments done. Next, India is the fourth largest producer of medicine in the world. These are the aspects which gives us the positive things about the healthcare in India. Then there are certain negative aspects also. First of all, most of the doctors in our country are settled in urban areas, and people in rural areas have to travel long distance to reach the doctors. Next means about 5 lakh people die of TB, that is tuberculosis, every year. Then people do not get clean drinking water. Not only water, there is lack of basic amenities in the life of the people. That includes water, shelter, clothes, etc. A huge number of children in India do not get proper nutrition. That means the proper balanced diet. They are malnutrition. This shows that there are certain loopholes in the healthcare facilities. Then, these healthcare services are divided into two parts, public and private. First of all, we are going to know about public healthcare services. These are generally run by the government. You will either be in shared or private accommodation. Here you don't get single rooms most of the times. Here there are many people in same big hall, depending upon the availability and the nature of your admission. You will generally be treated by the doctor available at the time of your admission. When you go to these government hospitals, whoever the doctor will be available, that person will be treating you. There can often be lengthy waiting periods. People have to wait in long queues to get their number for being checked up. It is free of charge for clinically necessary services. Some of the basic necessaries are free of services, free, totally free provided over here. Then, now the private healthcare services, they are generally run by individuals or big organizations. Here, we can get the private room depending upon the availability as well as the level of cover, means the amount we can pay. You can often choose which doctor you would like to be treated. We can get the doctor we want to be treated from. And here, there are no long queues to be waiting. Even if we have to wait, there is a proper sitting areas which is centrally air conditioned. All the facilities are available in that area. And you may have to pay an excess and out of pocket expenses. That means here the treatment is very expensive. Healthcare and equality. Healthcare in India is a major concern for the government and the people of country, as we are seeing in this scenario when we all are sitting home because of a pandemic. Not only India, entire world is facing the crisis. Every year, People die because of the inefficiency of the government to provide them treatment. The ratio of the number of doctors to the number of patients is very high. That means one single doctor has to see a lot many patients, which affects their efficiency. Almost 75% of Indian land area is rural area, which the area which does not have proper healthcare services. There are no proper hospitals, no doctors, no transportation, and even the lack of facilities are a lot. Mainly private services are available, and that too are concentrated in urban areas. People have to travel from these rural areas to the cities far off to get proper treatment. So we can see there is no equality. If the person is poor, he cannot get that level of treatment which a rich is getting. Here, the steps that the government should be taking to provide proper health care and equality over here. First of all, provide all the people with food, shelter, access to clean environment for better and healthy life. Secondly, add the facilities to diagnose diseases earlier, for which we need hospitals, medical professionals like doctors, nurses, support staff, etc. The government needs to increase all these facilities not only in urban areas but majorly in the rural areas. Here we are going to study next about the steps which were taken by Kerala government to improve the healthcare facilities of the state. First of all, the 40% of entire state budget was given to the panchayats. This made possible for the villages to plan the proper food and water supply and prepare for all the facilities to be provided in the village. Women development and education was also looked after. Here, the health centers were improved for better services. Next is the Costa Rica. Costa Rica is one of the healthiest country in the continent of South America. Here, the country decided not to have an army. Whatever the cost the army was to be spent upon, the money that was to be spent on the army, maintenance of the weapons and all, they used all that money for providing and developing their healthcare facilities. And the Costa Rican government provides all the basic amenities, basic services to all its citizens. This has helped to improve the healthcare facilities and the health of the people in this country to improve to a drastic level. So, this shows that what should be the concerns of the people, the government in India to be looked after. Thank you. That's all for today. Have a nice day.